In these series, everyone asks for how to treat gluteal tendinopathy, glut tendonitis, and how to fix your lateral hip pain. If you don't know, I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years. And yes, hip pain is a real pill. So even though this is an inherently stable bony joint, you need your muscles to move you through the entire range of motion. You have 6 deep hip muscles that are rotators of the hip, and usually your glute med is the one that is being a wuss bag. And I would like to think that the obturator internus is actually quite important as well. If you have a torn labrum and you have pelvic pain, your obturator internus is probably being a jerk and you have deep pain within, which, by the way, this is why I started caring about the hip, because I noticed in my women patients that had labral tears, they had pelvic pain. But anyway, we'll come back to that. So your glute med needs to be strong. Why is your glute med not strong? Well, because maybe you've lost weight, maybe you've atrophied because now you're an adult and you don't do fun things like get up and down from the ground like kids do. Maybe you're not doing sports anymore, and so you have atrophy. But if you've had a baby, or if you have a collagen disorder, or if you have hormone fluctuations, your tendons are shifting. And so places where tendons are compromised, so in a lady, we have a wider pelvis than a man, we have a wider Q angle, and the tendons, as they insert and attach to our femur, can be stretched, have excess strain placed upon them, because maybe the glute med muscle wasn't contracting as hard as it once was, so the tendon is hanging on for dear life. And the tenocytes change, and then there's a cellular change. And so your hormonal fluctuations, your atrophy, the way your bones are made, all set you up for glute tendinopathy, which tendonitis is micro trauma to the tendon, but I don't think it is always inflamed the whole time based on what little crap we know about tendonitis. This is why NSAIDs and steroids don't always work for tendonitis in the long haul. The best way to treat tendonitis is to actually work with the tendon. Now there's some caveats here. Follow for the part 2.